When people hear the word autism, many picture someone who is a little socially awkward, very smart, sensitive to sounds, or maybe someone who struggles with eye contact but can still talk, work, go to school, live independently, and explain their own needs. But severe autism, also called level 3 autism, profound autism, or very high support needs autism, can look very different. This video is about the children, teenagers, and adults with autism who need help with almost every part of daily life. The people who may never be able to live independently. The people who may be nonverbal or minimally verbal. The people who may need 24/7 supervision for their safety. The people whose parents and caregivers are often exhausted, scared, isolated, and worried about what will happen when they are gone. Severe autism does not mean a person has no value. It does not mean they do not feel love, joy, fear, pain, comfort, frustration, or connection. It does not mean they are less than, but it does mean their disability is real, serious, and often lifelong. Not everyone with autism is a quirky genius. Not everyone with autism can explain their needs, live alone, use the bathroom independently, or stay safe. Some autistic people need help with every part of life, from brushing their teeth to being changed, fed, supervised, protected, and cared for 24 hours a day. This is the side of autism people do not talk about enough. For some children with severe autism, basic self-care skills do not come naturally, even with years of teaching. Brushing teeth may require full assistance. A caregiver may have to put the toothpaste on the toothbrush, guide the child's hand, stop them from swallowing toothpaste, keep them from biting the toothbrush, and make sure their teeth are actually cleaned. Some children resist because the feeling of the toothbrush is overwhelming. Some gag, scream, run away, or become aggressive because they cannot tolerate the sensation. Some may not understand why brushing teeth matters at all. The parent may have to do this every morning and every night, not for a toddler, but for a child, teen, or adult who still cannot do it independently. Bathing can also be very difficult. Some children are terrified of water. Some love water so much that they are unsafe around it. Some cannot understand hot and cold. Some cannot wash their own hair or body. Some may try to drink bath water, smear soap, climb out unsafely, flood the bathroom, or become overwhelmed by the sound and feeling of the shower. A shower is a basic daily task for most people, but for a person with severe autism, it may require planning, patience, physical assistance, visual supports, safety precautions, and sometimes more than one adult. Getting dressed can be a daily battle. A child may not understand the steps. They may put clothes on backward, wear shoes on the wrong feet, refuse socks because of the seams, rip clothing off, or only tolerate certain fabrics. Some may remove clothing in public because they are uncomfortable, hot, overwhelmed, or simply do not understand that clothing has a social purpose. Some children, teens, and adults with severe autism do not understand that private parts need to be covered. They are not being bad or inappropriate on purpose. They may genuinely not understand social rules around modesty, privacy, or public behavior. This can become even more complicated as the child gets older. A small child taking off clothes in public may be seen as difficult or embarrassing. A teenager or adult doing the same thing may be treated as dangerous, sexual, or criminal, even when they do not understand what they are doing. Toileting can be one of the biggest challenges. Some children with severe autism are not toilet trained until very late. Some may never be fully toilet trained. Some teenagers and adults may wear diapers or pull-ups their entire lives. Caregivers may have to change them, clean them, deal with accidents, wash, bedding, clean furniture, prevent smearing, manage skin irritation, and carry supplies everywhere they go. This is not laziness. It can be connected to communication delays, sensory processing issues, poor body awareness, intellectual disability, anxiety, rigid routines, constipation, fear of the toilet, or simply not understanding the process. For some families, diapers are not a temporary stage. They are part of daily life forever. Feeding and eating can also be very difficult. Some children with severe autism have extremely restricted diets. They may only eat one brand of chicken nuggets, one type of cracker, one texture, one color, or food served in one specific way. A tiny change in packaging, shape, smell, or texture may cause them to refuse the food completely. Some children overstuff their mouths and choke. Some do not chew properly. Some gag easily. Some eat too fast. Some refuse most foods. Some eat non-food items like paper, dirt, soap, toothpaste, fabric, hair, plastic, or even feces. This is sometimes called pica, and it can be very dangerous. A caregiver may have to constantly watch what the person puts in their mouth. They may have to lock cabinets, hide cleaning products, remove small objects, and supervise meals closely. Communication can vary a lot. Some children can use PECs, pictures, an AAC device, signs, gestures, or a few words. Some can point to a picture of juice, bathroom, snack, outside, or help. Some can answer simple yes or no questions. Some can bring a caregiver an item to show what they want, but others cannot communicate in a meaningful way at all. They may not be able to tell you they are hungry, thirsty, in pain, scared, tired, constipated, sick, overstimulated, too hot, too cold, or hurt. That means caregivers often have to become detectives. They learn the child's cries, movements, facial expressions, sleep changes, food refusal, aggression, self-injury, and routines. A parent may realize he is hitting his head because his tooth hurts, or she is screaming because the tag in her shirt is bothering her, or he is crying because his stomach hurts, even when the child cannot say a single word. Medical care becomes much harder when a person cannot explain what is wrong. A child with severe autism may have an ear infection, tooth pain, reflux, constipation, a headache, a UTI, an injury, or a stomach ache, but they cannot say, "This hurts." Instead, they may cry, stop eating, bang their head, bite themselves, refuse to sleep, become aggressive, or seem behavioral. Many parents know the fear of wondering, is this autism or is something medically wrong? Doctor appointments can also be extremely hard. Blood draws, vaccines, dental cleanings, eye exams, EEGs, hospital visits, and even simple checkups can be overwhelming. Some children need sedation for dental work. Some need multiple adults to safely help them through medical procedures. Some cannot tolerate being touched, having their ears checked, opening their mouth, or sitting still. This is one reason severe autism is not just a developmental issue. It affects healthcare, safety, hygiene, pain management, and quality of life. Some children with severe autism have very limited danger awareness. They may run into the street. They may elope from the house, school, store, or playground. They may climb out windows, unlock doors, jump into pools, touch hot stoves, eat unsafe objects, break glass, run toward dogs, or walk away from caregivers without understanding the danger. They may not understand cars. They may not understand strangers. They may not understand deep water, fire, heights, sharp objects, or unsafe places. This is why many families live under constant supervision mode. Doors may have extra locks. Windows may need alarms. Parents may sleep lightly or not sleep at all. A child may need to be watched every minute because 5 seconds can be enough for them to run, climb, choke, flood a bathroom, hurt themselves, or disappear. This level of supervision is hard to explain to people who have never lived it. It is not the same as watching a typical child. A typical child slowly develops awareness and independence. A child with severe autism may still need toddler-level supervision at age 9, 15, 25, or 40. Transportation can also be a serious challenge. Some children unbuckle their seatbelts. Some scream the entire car ride. Some kick seats, attack the driver, open doors, refuse to get in the car, or refuse to get out of the car. Some need special locks, harnesses, adaptive car seats, or 2 adults present just to travel safely. Even a simple trip to the grocery store can become complicated. A child may run through the parking lot, grab food, scream from the lights and noise, drop to the floor, bite, hit, or try to escape. Strangers may stare, judge, or make comments, not understanding that this is not bad parenting. Sleep problems are another major part of severe autism for many families. Some children and adults with severe autism sleep very little. They may wake up throughout the night, laugh, scream, cry, wander, climb, destroy things, turn on water, get into food, or try to leave the house. A parent may not be able to simply go to bed and sleep. They may sleep near the child, use alarms, keep doors locked, and wake up at every sound. Some caregivers live for years with broken sleep or almost no sleep at all. Sleep deprivation changes everything. It affects the caregiver's health, mood, patience, marriage, work, and ability to function. But many families have no choice. They are on duty during the day and on duty at night. Aggression and self-injury can also be part of severe autism. Not every person with severe autism is aggressive, and it is wrong to act like they all are. But aggression is common enough that families need honesty, not shame. Some children may hit, bite, scratch, headbutt, pull hair, throw objects, break furniture, punch walls, or attack caregivers. Some may hurt themselves by headbanging, biting their hands, scratching their skin, slapping their face, picking wounds, or throwing themselves to the floor. Sometimes this happens because they are frustrated and cannot communicate. Sometimes it is sensory. Sometimes it is pain. Sometimes it is anxiety. Sometimes it is a response to being told no, transitions, demands, or changes in routine. There is also a difference between a tantrum and a meltdown. A tantrum is usually goal-directed, like wanting something and reacting when they do not get it. A meltdown is more like the nervous system becoming completely overwhelmed. The person may lose control because the lights, sounds, demands, pain, emotions, or changes are too much. But whether it is frustration, communication, sensory overload, or a meltdown, the danger can still be real. A caregiver can understand the reason behind the behavior and still be injured, scared, or exhausted by it. For the caregiver, this can mean bruises, scratches, bites, broken glasses, holes in walls, destroyed furniture, and a constant fear of what might happen next. It can also mean guilt, because the caregiver loves the person deeply but is also physically and emotionally exhausted. Property destruction is another reality many families deal with, not because the child is bad, but because of impulsivity, sensory seeking, meltdowns, aggression, curiosity, or lack of understanding. A family may deal with broken TVs, ripped mattresses, holes in walls, broken windows, flooded bathrooms, food dumped everywhere, toys destroyed, clothes ripped, feces smeared, cabinets emptied, or furniture damaged. Families may have to modify their homes for safety instead of appearance. They may remove decorations, lock up food, remove window cranks, install alarms, hide cords, bolt furniture, or keep rooms almost empty. Childhood with severe autism may involve therapies, IEP meetings, special education classrooms, speech therapy, occupational therapy, behavior plans, feeding therapy, sleep problems, medical appointments, sensory needs, and constant advocacy. Parents may spend years trying to teach basic things like using the bathroom, washing hands, using a spoon, tolerating shoes, sitting safely in a car, brushing teeth, or not running away. And progress may be very slow. Sometimes a skill takes years. Sometimes a skill appears and disappears. Sometimes the goal is not independence, but safety, comfort, and reducing distress. Then puberty can bring a whole new level of challenges. A child who was already hard to care for may become bigger, stronger, and harder to physically guide. Hormones can increase mood swings, aggression, anxiety, sensory issues, sexual behaviors, sleep problems, or emotional outbursts. A teenage boy who hits is different from a small child who hits. A teenage girl who needs help with periods may not understand what is happening to her body. A teen may need help changing pads, managing hygiene, showering, using deodorant, changing underwear, dealing with body odor, acne, shaving, and understanding privacy. Puberty also brings sexual development, and this can be very difficult when the person does not understand social rules. A teen or adult with severe autism may touch themselves in public, remove clothing, expose themselves, touch others, hug strangers, stand too close, or not understand consent and personal space. This does not mean they are being intentionally inappropriate, but it does mean they need careful teaching, supervision, and protection. This is one of the hardest topics, but it matters. People with severe autism are often extremely vulnerable. If they cannot communicate clearly, they may not be able to report abuse, pain, neglect, bullying, or fear. They may not be able to say, "They hurt me." They may not be able to say, "I am scared." They may not be able to say, "This person touched me." They may not be able to say, "I do not want to go there." They may not be able to say, "I am being neglected." That means caregivers have to be extremely careful about who is around them. This is one of the biggest fears families have about schools, transportation, respite workers, group homes, and residential facilities. As children with severe autism become adults, the world often becomes even smaller. School services eventually end. Many programs disappear. The adult may still need help with bathing, toileting, dressing, eating, communication, medication, transportation, safety, and behavior. But the parent is older, more tired, and may have fewer supports. Some adults with severe autism can attend day programs. Some can do supported activities. Some may enjoy music, walks, swimming, puzzles, sorting items, sensory toys, car rides, favorite foods, or routines. Some may have beautiful relationships with their families even without speech, but they may still be fully dependent. Many adults with severe autism cannot manage money, cook safely, take medication, call for help, understand emergencies, cross streets, keep themselves clean, or live alone. Some cannot be left alone for even a few minutes. For some families, the adult child will eventually need a group home, residential facility, or another setting with 24-hour supervision. This is not because the parents do not love them. Often it is because the level of care is too intense for one aging parent to safely provide forever. And then there is the question every parent of a severely autistic child carries. What happens when I die? For a child with mild disabilities, parents may worry but still imagine some level of independence. For a child with severe autism, the fear is different. Who will know what their sounds mean? Who will know when they are sick? Who will make sure they are not neglected? Who will change them gently? Who will protect them from abuse? Who will understand their routines? Who will love them when the parents are gone? Some adults may live with siblings or relatives, but that is not always possible or fair to assume. Some may live in supervised residential care. Some may have legal guardians. Some may depend on state services, Medicaid waivers, disability benefits, and long-term care systems. Families may need to think about guardianship, SSI, Medicaid, special needs trust, adult day programs, residential placement, waiting lists, future caregivers, and who will advocate after the parents die. These are not small decisions. These are lifelong planning issues. And many families face waiting lists, limited options, staffing shortages, underpaid workers, and fear about the quality of care their child will receive when they are no longer able to provide it themselves. Severe autism affects the whole family. Parents may live with chronic sleep deprivation, financial stress, isolation, judgment from strangers, and constant planning. Siblings may grow up with deep love for their brother or sister, but also stress, embarrassment, fear, resentment, responsibility, or less attention from parents. Marriages and relationships can be strained. Families may stop going places because the world is not safe or accessible for their child. They may avoid restaurants, stores, vacations, parties, weddings, religious services, and family gatherings because it is too overwhelming or unsafe. Even simple outings can be complicated. A trip to the grocery store may involve screaming, running, grabbing food, dropping to the floor, sensory overload, stares from strangers, or danger in the parking lot. A dentist appointment may require sedation. A haircut may feel impossible. A family vacation may not be realistic. Holidays may be overwhelming instead of joyful. Parents may also live with complicated emotions that other people do not always understand. You can love your child fiercely and still grieve. You can be grateful for your child and still feel exhausted. You can believe your child has value and still wish life was easier for them. You can adore your child and still be scared of the future. That does not make someone a bad parent. It makes them human. This is why it is harmful when people say things like, autism is just a different way of thinking, or everyone is a little autistic, or you just need to accept them. Acceptance is important, but acceptance without support is meaningless. Families of people with severe autism need acceptance, but they also need respite care, safe schools, trained staff, therapies, medical support, behavior support, financial help, residential options, and long-term planning. They need people to understand that loving someone does not how hard it is. Talking honestly about diapers, aggression, hygiene, puberty, self-injury, and residential care is not disrespectful. What is disrespectful is pretending these realities do not exist and leaving families without help. A child with severe autism may be deeply loved and still need 24/7 care. An adult with severe autism may have joy, personality, preferences, emotions, and relationships, and still need diapers, supervision, and help with every daily task. A parent may adore their child and still be exhausted, scared, and grieving the life their child may never have. Severe autism is not the whole autism spectrum. Many autistic people can speak for themselves, live independently, work, marry, advocate, and explain their experiences. Their voices matter, but people with severe autism also matter, including the ones who cannot speak, cannot explain, cannot advocate, and cannot safely live alone. Their reality should not be erased because it makes people uncomfortable. Severe autism is not a parenting failure. It is not lack of discipline. It is not something families are exaggerating. These children and adults deserve dignity, safety, love, and support. And their caregivers deserve honesty, help, and a world that does not look away.